Danish-InfoNews TV special report. Welcome to this special edition of Danish-InfoNews TV. Today we take a closer look at one of the most complex and often misunderstood intersections of Danish public policy: immigration and healthcare access. Denmark is widely recognized for its universal, publicly funded healthcare system. But how universal is that care when it comes to immigrants, asylum seekers, and undocumented individuals? Does everyone residing in Denmark truly have equal access to treatment? Or does legal status determine the level of care? Join us as we explore the rights, challenges, and realities facing immigrants within the Danish welfare state, and how healthcare has become both a lifeline and a legal battleground. Understanding immigrant status in Denmark. Before diving into healthcare access, it's important to understand the diversity of legal statuses among immigrants. These categories often shape what services individuals are entitled to and what barriers they face. Here's a breakdown of key immigrant statuses in Denmark. Immigrant, a broad category including all individuals born outside of Denmark with at least one parent who neither held Danish citizenship nor was born in Denmark. Naturalized citizen, foreign nationals who have become Danish citizens through naturalization, usually after years of legal residence and meeting certain criteria. Legal permanent resident, individuals granted the right to reside permanently in Denmark, either under EU law or other legal pathways. Refugee, individuals recognized under international and Danish law as having a well-founded fear of persecution in their home country. Asylum, those who have applied for asylum in Denmark and received protection due to serious threats in their home countries. EU/EEA citizens and family members. Citizens of the EU or EEA and their families have special rights to live and work in Denmark. Other residence permits, including permits granted for family reunification, employment, education, or other specific reasons. Permanent residence allows individuals to live in Denmark indefinitely, often after continuous legal residence and other qualifying factors. Temporary protection status, granted in situations of general instability or violence in the applicant's country of origin. Stateless persons, individuals not recognized as nationals by any country under its laws. These categories can overlap during a person's journey. For instance, a refugee might later obtain permanent residence or become a naturalized citizen. Legal status is dynamic, and it's this legal framework that determines healthcare rights. Immigrants' rights and healthcare access in Denmark. Denmark's healthcare model reflects the nation's ideals of equality and social responsibility. Yet immigration policies, growing stricter over the years, have created a tiered system of access. 1. Legal residence, full access to public health care. Immigrants with valid residence permits and CPR registration receive access nearly identical to that of citizens. A yellow health card, Sygesikringskort. Free visits to GPs, hospitals, and specialists with referral. Subsidized prescriptions and physiotherapy. Free dental care for children. Denmark's health system is among the most comprehensive in Europe for those legally registered. 2. Asylum seekers. Limited and controlled access. Asylum seekers aren't part of the national health insurance system. Their access includes emergency and urgent care, basic treatment at asylum center clinics. Referrals to specialists only with prior approval. Mental health care remains difficult to access, despite a high burden of trauma-related conditions. 3. Undocumented immigrants. Life on the margins. Those without legal residency have extremely restricted access. Emergency treatment only, acute illness, childbirth, life-threatening conditions, no routine care, preventive medicine or chronic disease management. Free, anonymous healthcare is offered by NGOs like the Danish Red Cross in major cities. Yet fear of detection and deportation deters many from seeking help, even when eligible. Systemic barriers. Beyond legal status, even legally residing immigrants can struggle to navigate the system due to language barriers that complicate medical communication, cultural misunderstandings between patients and providers, limited trauma-informed mental health services, lack of awareness about their healthcare rights. Integration into the health system demands more than paperwork. It requires trust, communication, and ongoing support. Immigration policy trends from permanence to temporariness. A major shift in 2019 saw Denmark reframe residence as a temporary condition by default, even for refugees. This paradigm shift led to increased short-term permits with strict renewal conditions, harder pathways to permanent residence or family reunification, a climate of legal uncertainty that negatively affects health. These policy trends place vulnerable populations in prolonged limbo, making consistent healthcare access difficult and deepening public health inequalities. In theory, Denmark's healthcare system is universal. In practice, it mirrors broader societal choices: who belongs, who is protected, and who is left on the margins. Legal status is a gatekeeper to care, and while NGOs and volunteers work to fill the gaps, systemic inequities remain. Healthcare is not just about medicine. It's about dignity, inclusion, and the values we choose to uphold as a society. Resources for immigrants and supporters new to Denmark, nydenmark.dk, the official immigration portal for residence, work, and healthcare, writes Danish Red Cross clinics. Free confidential care for those without public healthcare access, immigration lawyers in Denmark, for legal advice and status clarification. Denmark's universal healthcare system is often lauded as a model of equity and social responsibility. Yet, as this report has shown, the reality is far more nuanced, especially for immigrants, asylum seekers, and undocumented individuals navigating the Danish welfare state. Healthcare, while theoretically a universal right, is in practice deeply entangled with legal status, immigration policy, and broader societal attitudes toward inclusion. Through the breakdown of immigrant categories, from naturalized citizens and permanent residents to refugees, asylees, and undocumented migrants, we see how legal identity shapes everyday access to care. For some, a yellow health card opens the door to one of Europe's most robust healthcare systems. For others, especially those stuck in temporary or irregular statuses, healthcare becomes precarious, defined by emergency services, limited mental health resources, and fear of detection. The 2019 paradigm shift in Danish immigration policy marks a significant turning point. By rebranding residence as temporary by default, even for refugees, Denmark introduced greater insecurity into the lives of those who already face displacement, trauma, and socioeconomic hardship. This legal limbo undermines not only the physical and mental health of individuals, but also public health outcomes and efforts towards social cohesion. Even among legal residents, challenges persist. Language barriers, cultural misunderstandings, and insufficient mental health support, especially for trauma survivors, undermine the accessibility and effectiveness of care. These systemic issues require more than legal solutions. They demand institutional sensitivity, cross-cultural competence, and proactive outreach. Non-governmental organizations like the Danish Red Cross play an essential role in filling the gaps left by public policy. Their free clinics provide a critical safety net for undocumented migrants and others who fall outside the formal system. However, such efforts, while noble, should not be the only line of defense in a society that claims universality in its healthcare ethos. At its core, this report reveals a profound tension between Denmark's welfare ideals and its immigration practices. Healthcare access reflects more than administrative policy. It reveals who we consider part of the community, who is protected, and who is left behind. In a country that prides itself on fairness and equality, it's worth asking, can a system be truly universal if it excludes the most vulnerable? Can health truly be a right if that right is contingent upon where you were born, how you arrived, or what papers you carry? As Denmark continues to grapple with its identity in an increasingly globalized world, the intersection of immigration and healthcare offers a powerful lens. It forces policymakers, practitioners, and citizens alike to confront uncomfortable truths and to decide whether the values of solidarity and inclusion can stretch to meet the realities of an evolving, diverse population. Because in the end, healthcare is more than a service. It is a reflection of who we are, what we value, and how we care for one another, regardless of borders, status, or origin. If you'd like us to explore more in-depth reports on immigration, healthcare, or integration in Denmark, let us know. For more stories like this and continuing coverage of social policy in Denmark, subscribe to Danish-InfoNews TV. Stay informed, stay engaged.